My name is Kamal Aryal. I'm chairman of the Nepalese Doctors Association, and by profession, I'm consultant laparoscopic surgeon at James Paget University Hospital, and I'm also senior lecturer for University of East Anglia. I would like to welcome you all to Nepalese Doctors Association UK. Nepalese Doctors Association UK was started in 1985 by our senior doctors, and we are very grateful to them. When it was established, the organization had 5 aims, which continue to the present day. Here, I would like to present our national emblem from Nepal, which states, Janani Janmabhumischa Swargadapi Gariyasi, mother and motherland are better than heaven. This national emblem, the purpose of this is reflected on our aims like any other Nepalese organization which is located outside Nepal. And the main words which comes out from here is Nepalese doctors and their families, health professionals and other groups who have similar interest, who are in UK, but their heart is towards Nepal. And this is achieved through cooperation and collaboration. So for the benefit of our members and for our motherland. This was founded in 1985 and it was inaugurated by Mr. Iswariraj Pandey, the ambassador that time. Since then, we have wonderful relationship with the Nepalese embassy in London, and we are very grateful for the support. Here, I would just like to mention a little bit about what Nepalese Doctors Association generally does, where we want this organization to go ahead, and why you should become members of the Nepalese Doctors Association if you are doctors or their families who are residing in the UK. One of our most important events is the 3-day weekend event, which generally happens in the last weekend in July. Due to COVID, last 2 years, we had to do it virtually, but we are hopeful that we'll be able to resume it again this year. In addition, we do charity fundraising dinner at least once a year, and the next one is scheduled for 2nd of April in Norwich. We conduct a number of workshops for trainees, which is helpful for them. This includes things like acutely ill patients, how to become an NHS consultant, lab and beyond, which we conducted recently, and how to get to medical school. The Careers Day, generally held in October. We have been conducting a number of webinars related to COVID. Before the COVID started, we used to do face-to-face health awareness and education program. The area in UK where we have been doing those starts from Wales, Combram to Colchester here in the east of England, and to the north of England to Catterick Garrison. This is mainly aimed to our brothers and sisters coming from the Gorkha background who do not have much knowledge about the National Health Service and how to utilize these services for their health. In addition, we conduct regular educational activities for the COVID and related things for our communities, as the face-to-face event had to be cancelled because of the COVID. We have been doing these sort of events virtually in association with different organizations, including Nepalese Nursing Association, Non-Resident Nepalese Association, and also Federation of Nepalese Journalists Association. In addition, in Nepal, there are a number of activities we try to conduct each year, And one of the main events which we have conducted, and we are very grateful to Dr. Sumindra Poon, who has been organizing some scholarship program after the charity dinner here in the UK, and this has supported number of staff nurses and the auxiliary nurse midwives. In addition, there are a number of other courses we have been organizing, including anesthetic, then surgical. This one is anesthetic here, Dr. Shambhu Acharya. Before that was Dr. Ramesh Koju in the previous screen. Then we have been conducting this laparoscopic skills workshop. We did it for 7 years at Dhulikhel, which we continue to do. And then we have expanded this to Pokhara last year. In addition, Dr. Bhagwan Koirala here, where we conducted a symposium on patient safety. We are very grateful to the Royal College of Surgeons of Edinburgh for their support. Here is President of the Royal College of Surgeons of Edinburgh, Professor Mike Griffin. Then before that, immediate past President, Professor Mike Lavelle-Jones. And before that, Mr. Ian Ritchie. All of them have helped us a lot, and I are very grateful. The oldest surgical college in the world. The exams used to be held there before, and we are trying to establish their connection and relationship with Nepal again. Again, we are very grateful to our friends at Dhulikhel and Professor L.B. Thapa here, along with Professor Mike Lavelle-Jones. And I said about this laparoscopic course, and the impact has been very positive, and we have been able to publish this result in World Journal of Surgery. In addition, during the COVID times, there have been a number of efforts by us to try to help our motherland and our education and health in Nepal. And again, we are very grateful. Here is a Health Exchange Nepal with whom we have done a lot of work, and oxygen cylinder here, oxygen concentrators here, and this is the CPAP machine, which is made with the help of the snorkel mask. And we are grateful that these have reached at the villages and remote places, helping our patients, not only in the center, but at remote and all over Nepal. We have also been able to contribute towards the establishment of 88-bedded Radha Swami Field Hospital. We contributed 10,000 pounds towards this. We have been conducting COVID webinars before the pandemic started in Nepal, because the pandemic started here first in the UK, and then it went to Nepal, and we used that opportunity to interact with our friends in Nepal, and that has been helpful for us as well as our friends in Nepal. We learn both ways. It's not that we teach, we learn from them, and we hope they learn from us as well. Again, we have conducted webinars about the treatment with the help of oxygen, the non-technical skills for surgeons. We couldn't visit Nepal last year because of the COVID, but we conducted using online platform. Again, I'm very grateful to Professor Paleswan Joshi Lakhe at Institute of Medicine, with whom we collaborated and conducted them. The laparoscopic general surgery and laparoscopic colorectal surgery course we did online last year, as we could not travel there ourselves. And we have conducted a number of tele-consultations during COVID-19 times. I'm very grateful to Dr. Sudhir Lohani, who has played great role towards it. I took this chairmanship in August, and these three are our vision. Membership, we need to increase the membership. The charity work, we need to increase that, and we need to work more collaboratively for the benefit of all of us. So main aims to increase the membership. There are more than 500 doctors in the UK, but not all of them are members of the Nepalese Doctors Association UK. I urge all the doctors to become members. I'll tell why in the next page. Then we want to collaborate with other stakeholders for the benefit of all of us and for the benefit of our communities and our motherland. We want to expand the keyhole surgery course we have been conducting in Nepal to other centers, currently at Dhulikhela and Pokhara, but we want to do it other places. Other specialty training courses in Nepal, including anesthesia and medicine. Some of them are already happening, but we want to expand this. We have been conducting during COVID times the Sandringham Charity Run. We conducted in September, which went on quite well. We want to do similar thing in the future. There is charity dinner on the 2nd of April 2022, and I'd like to welcome you all to that great event. And again, we continue to do more health education and awareness programs. The question may arise, what is the benefit of getting membership as a doctor? I think if you are a member, it increases the sense of belonging and ownership towards the organization. You are part of that organization, and the feeling that you are contributing towards it, there is a great sense of feeling and achievement. And also you are part of the family. NDA-UK, we think the doctors and their families is a big family in UK, and that is reflected in our July annual general meeting, where we feel that we are meeting the wider family together. It provides the opportunity to network with each other and learn from each other. The educational events and resources are of great help. There are many consultants and many researchers who are senior consultants in different specialties, which is quite helpful for everybody. And if you are a member, then the annual general meeting in July, the 3-day event, there is reduction towards that cost if you are a member. And then again, it provides leadership and management opportunities. If you join to this organization, there are a number of activities conducted, including charity, educational activities, and that helps you towards your management and leadership activities, and that improves your CV. I have had many trainees who have contributed towards this to a great extent within the last few months, and it is a great pleasure to provide them this evidence that they have been involved in the leadership and management, which helps them towards obtaining training grade posts, which is of great help to become future consultants in the United Kingdom. We collaborate with other organizations, and I hope this is helpful for all of us, for all the organizations which we have collaborated with, not only us, but them as well. And it provides an opportunity, a platform to do a lot of charity work, and you can help other people, and that provides your portfolio. And the biggest thing is you are able to help our people who are in need of that help. With this, I'd like to thank you all. And again, I want to invite you to join this organization, which is a great organization in the world. Thank you again.